Hello, everyone. I'm Congresswoman Kathy Castor of Florida and the former chair of the House Select Committee on the Climate Crisis. Thanks to the Medical Society Consortium on Climate and Health for the opportunity to be with you today. And thank you for traveling to Washington, D.C. to help educate policymakers on the climate health nexus. Your work is absolutely critical. As a former chair of the Climate Committee, my colleagues and I worked with public health professionals like you to examine the risks posed by climate change on human health. We learned that the changing climate is a public health threat multiplier. It can affect our health in a myriad of ways by intensifying heat waves, floods, other extreme events, by degrading air quality, and by increasing the risk of infectious diseases and how they emerge and how they spread. Moreover, the burning of fossil fuels is exacerbating the climate crisis. It directly threatens the health of communities across America. Pollution from cars, power plants, industrial processes cause respiratory and cardiac conditions and exacerbates chronic conditions like diabetes and asthma. Air pollution is also a major risk factor when it comes to maternal health, where we're in crisis in America right now, especially in historically disadvantaged communities. Studies demonstrate that Black mothers are at particularly high risk of preterm birth and lower birth weight. These health issues and emergencies caused by surging climate impact risk are straining our hospital systems. We need more public health professionals and really weighing down the entire health sector. And it's not going to get any better unless we make progress. But thankfully, we are making progress. Actions to reduce carbon pollution and bolster climate resilience can improve public health at saving lives and generating billions of dollars in health-related economic benefits. At the federal level, I'm very proud that the Democratic-led Congress passed the Inflation Reduction Act. That's our historic clean energy, climate, and resilience law signed by President Biden. It was driven by a coalition of health professionals like you and environmental and clean energy advocates. You deserve all the credit in the world for helping us get the Inflation Reduction Act and the bipartisan infrastructure law across the finish line. So thank you. Thanks to these laws, the U.S. is now on track to cut up to half of its emissions by 2035. Energy modelers now believe that total solar and wind generation in the U.S. will double by 2025, and then nearly double again by the end of the decade. Monthly sales of electric cars and trucks are booming as well. So every EV we put on the road, every solar panel installed, every wind turbine that is turning, we are displacing fossil fuel pollution and improving the health of our communities. In addition, the Inflation Reduction Act included some key policies recommended by the Select Committee on the Climate Crisis, focused on environmental justice and health equity. It invested more than $8 billion for air and climate pollution reduction grants in historically disadvantaged neighborhoods and provided key funds for community-level resilience. Looking ahead, it's vital that the Biden administration get the IRA and all of the climate investments out the door effectively to the communities that need them most. And then Congress must ensure that the agencies charged with leading these initiatives, like EPA and HHS, have the resources through the annual appropriations. And boy, that has not been easy in the Congress this year. There are a lot of fossil fuel promoters in the House of Representatives, and if they had their way, they would zero out these climate investments and they would hamstring the agencies that are necessary to help get these investments out the door. Plus, there's an elephant in the room. November's presidential election. That election will determine the trajectory of our ability to lower costs and improve health through cleaner, cheaper energy. It will determine whether we're going to continue to make climate progress or not. As anti-public health and anti-environment politicians would have their way, they would roll back all of the rules that are underway for clean energy and the investments necessary to put America on a path towards a safer climate. As experts in public health, you are trusted messengers. You're trusted messengers to the public, but to policymakers as well. Doctors, nurses, and other health professionals play a central role in raising awareness of the health threats of climate change, and you help spur action. That's what I'm hoping you all will bring your energy and know-how to Capitol Hill and to other policymakers across Washington, D.C. Help through your effective communications. Help convey the immediate health benefits of moving from fossil fuels to cleaner, cheaper energy. For example, gas-powered furnaces and home appliances are proven not only to contribute to climate pollution in the form of methane gas, but they also generate indoor air pollution that can exacerbate respiratory illnesses and cause childhood asthma. Electrifying home heating with technologies like heat pumps and induction stoves can immediately curb those emissions and make our homes safer while lowering electric bills. Help explain this to policymakers. It's the same idea with gas-powered cars, which emit CO2, nitrogen oxide, and other pollutants. EVs release none at all and can really help improve the air quality and our health. Too often, the politics of climate change distract us from the harsh reality that burning fossil fuels is not only harming the planet, but it's harming our health every day. And some of those communities take on the more burden than others. But with your help, we can cut through the noise and disinformation. We can better communicate the public health benefits of cleaner, cheaper energy. Together, we can build large coalitions among policymakers to push more Americans to vote like the climate depends on it, because it does. So thank you all again for the opportunity to join you today and give you a little pep talk. Thank you for taking the time out of your busy lives to come to Washington, D.C. And please let me know how I can support your important work. Thanks again.